So, talk to us about the workflow of follow-up care, and particularly when there's an ER visit, because that's for sure one of those where, my gosh, if done right as a parent, it's like loyalty for life. If done wrong, it's like all hell breaks loose. So, how did y'all come up with this very creative, unique workflow, and how did you arrive at that?
So I can kind of lead in on this. This was another one where we took feedback from both staff and parents, right? Like going to the emergency room is a stressful event, and as a parent, like you just want to feel heard and you want to feel that like everybody knows all the details of your child, right? Like that's your only concern. And so the last thing you want to do is come into clinic for a follow-up and start at scratch and say like here's what happened, as if like the provider doesn't know anything about it, right, the clinician. And so us being able to know ahead of time like where they were seen, so that we can either, if it's a system we can pull the records from, if it's available to us through through the patient itself, or if we have to call and request the records, we want to try and get that information in our clinicians' hands as soon as possible so that they know the backstory going into that patient's room.
What has the response been?
We have like a rate, right, of like
Mhm.
complaints or things like that. But I mean, it's worked really well for us. They really don't even know they're providing us that information, right? Like it's all based on like a tree, right? So they say they're calling to schedule or they're online, trying to schedule a follow up appointment, and Luma just guides them through what type of a follow-up appointment is it? Is it an urgent care ER? And we have more time that it looks for. If it's just, something basic, an ear infection, we only need 15 minutes for it. And so all of that is, it's like your own little step-by-step AI kind of guiding them down into what they have for appointments and availability. So I don't think they really even know that it's a
Mhm.
more complicated process, but we're drilling down into offering them what they really need for appointment times.